Hi guys, Shannon here. Just wanted to hop on and go over some of the things in the cabinet of goodies. I really wanted to talk about the different types of fillers there are. Number one, I most always use the Clarius Ultrasound prior to doing any fillers. For me, this is an absolute for safety, so I can do some vascular mapping, determine where the vessels lie in your face, and so I can avoid them and steer clear. So prior to doing fillers, I usually always use the Clarius Ultrasound. There's sometimes I won't use it, like if it's the lips maybe and I'm just doing a small amount, then it's not really 100% necessary, but definitely ultrasound, very important for your safety. Ask your provider if they have an ultrasound if you're not coming to me. Next, I have Kybella, and Kybella is an injectable that goes in the submental fat and dissolves the fat. Sometimes it can be done in one treatment. Sometimes it might take 2 or 3 depending on how much adipose tissue there is, but this is Kybella, no more double chin. You can also use Kybella for the jowls, for the, that hanging skin, as long as it's fatty and not just sagging tissue. Next we'll talk about Asclera. Asclera, I have a 5% and a 1%. The 5% is for those little blue veins, spider veins, and the 1% is more for the bigger vessels that are a little bit deeper, called reticular veins. These get injected right into the branch vessel, and the spider veins just disappear right in front of your face. A lot of the times it's one and done. Sometimes it takes a few treatments, but if they're very superficial spider veins, then it might just take one treatment and they're gone. So it's pretty amazing, this stuff. It's a miracle. Next we'll talk about Restylane. So I have Restylane Kiss. This filler is by Galderma, and it is specifically made for the lips, and it is a beautiful, beautiful result. I also use Kybella and Ultra for my lip filler patients, but Restylane Kiss is really, really pretty, really soft, and not too much. Then we'll go into Restylane Refyne. So Restylane Refyne is for the perioral area, the really small vertical lip lines, smoker's lines around the mouth, little micro wrinkles around the mouth. Beautiful, beautiful for filling small little wrinkles. Next we'll talk about Restylane L, and Restylane L just means lidocaine. So there's lidocaine in the syringe, which means as soon as I get some in there, then the tissue starts to numb. And this Restylane L has been out for a long time, but it's still one of my favorite fillers, just because it's really thin and low viscosity, low cohesivity. So this is also good for the perioral area, smoker's lines, marionette lines, really pretty, not bumpy or anything like that, just really soft and just pops those wrinkles up and makes them disappear. Next we'll talk about Voluma. So that was the Galderma line, and Voluma is Juvederm, which are the makers of Botox, Kybella. Also, Galderma makes Sculptra, which is an amazing, I love the full face filler with Sculptra. It's not really a filler, but what it does is it activates your own body's collagen. So with Sculptra, the results are not immediate as they would be with filler, but it is a very natural, progressive volume production. And I don't have that on stock all the time. It's just not quite as popular here in Colorado as it was at my last place in California. But it's just